care and domestic work in homes and communities. And although there is not a single solution to address women's disproportionate responsibility for unpaid care work, there is the need for solutions to be tailored to the particular type of situation. Well, in this regard, ActionAid Ghana is advocating for especially child care centers to be made available at workplaces as well as marketplaces to bring relief to women.
Unpaid care work refers to all unpaid services provided within a household for its members, including care of persons, housework, and voluntary community work. This is considered work because, theoretically, one could pay a third person to perform them. According to the Ghana Living Standards Survey, a typical Ghanaian woman works on an average of 13 hours per day. However, while 40% of her day's work is paid, the majority of her work is unpaid. Cooking and caring for children make up for the majority of a Ghanaian woman's daily unpaid tax and is perceived to be less valuable than paid work, therefore ripping it off the recognition that it deserves. In this regard, ActionAid, in a second national dialogue on unpaid care work, has stated that the unpaid care work burden be redistributed. Unpaid care has been given a female face globally, and whereas the overall amount of unpaid work remains the same, it must be fairly shared among males and females.
All make a commitment to redistribute the care work among the members of the household, care work among men, women, care work among boys and girls, male, female, youth. We should all participate in care work because it is work and its impact is huge on those who do it.
Unpaid care work tends to reduce women's full participation in the formal sector by the provision of services in a different way by government, like childcare services at workplaces, and the provision of basic amenities such as the closeness to water sources and easy accessibility to healthcare can reduce the burden of unpaid care work. And Margaret Brew-Ward, the Women's Rights and Campaigns Manager for ActionAid Ghana, advocates for this.
The state can come up with policies that will compel employers to also provide childcare services at their workplaces or in the environment, so that women of childbearing age who have the responsibility to maybe care for their children can take their child to work. If the child is not feeling so well, then the woman can work, have in between the work hours, can go and see the child, maybe breastfeed the child or something, and will give up a bed. In fact, it will even encourage or improve the woman's productivity.
On August 7, 2019, a Kenyan Member of Parliament, Zuleika Hassan, said she had brought her 5-month-old child with her to the workplace because of a domestic emergency and that Parliament didn't have a crèche. Speaker Christopher Omulele ordered Hassan out of the chamber and said that she could return without the baby.
The Honorable Zuleika kindly withdraw with decorum. Order! Order!
Turning a blind eye to unpaid care work hampers efforts to address inequality and reduce poverty in all countries, making the achievement of Sustainable Development Goals 1 and 5 almost an impossible task.
You want to find out more why ActionAid is embarking on this campaign? Well, joining me over the phone lines is Margaret Brew-Ward. Well, she's been speaking to this issue, but it's a Friday. Would want to get some more details on issues with child rights campaign, and she joins us to get some more on this with ActionAid. So, yes, what they are calling for, and I'll just break it down a little bit before I take some answers to the questions I put to her. They're calling on government to initiate policies to reduce unpaid care work done by individual women for economic and societal benefit. But the question will remain. So, Margaret, why is it imperative for such policies to be put in place? And how is the absence of such policies affecting these women and people who are carrying kids or who are engaged in unpaid care work?
Thank you very much. Good evening to your listeners. It is important for policies and for state intervention in that women and all those who provide care services are contributing greatly to the gross domestic product of this country or to the economic development of this country, in that the care services people provide enables labor, gives labor, allows people to dress sharply and go to the factories, to the companies, and to into work in all the sectors of the economy that brings or leads to growth. So therefore, it is important for the state to recognize that care work is work, value it, and once it is valued, it becomes respected. It is respected. And it's therefore anyone doing this care work which is not paid, at least that person's contribution at that level, whether it is at the family level, the household level, is respected and also valued. Secondly, we need state intervention because it is the responsibility of the state to provide public services. And public services in the form of, can be in the form of childcare services, such that it is affordable and it is within reach of people who provide the care services. There are quite a number of women I have examples of women who have to quit or have less lucrative jobs as a result of care work. But if the state intervenes and provides some of these services, child care services, maybe provision of water in households, some health facilities very close to communities or in communities like that, if I'm caring for the sick, whether male or female, I wouldn't have to travel long hours to even access the health facility. In that case, it reduces the time of the person providing the care service, which is not paid, to spend on the care the person is providing, and the person would spend some time to invest in other aspects of his or her life.
So just before you go on, so you are advocating for a policy. I mean, I'll take you back to Kenya, where the lawmaker was thrown out of the chamber because there was no room for her to bring a baby into the chamber. What are some of the key things that you would want to see in this policy?
Some of the key things we want to see in this policy, for instance, the Kenyan example you gave to us, I don't know whether even in our parliament we have it. I don't know, so I cannot comment. But some of the things we want to see in the policy that we can make it a policy that every public place, every organization, whether be it a company, institution, or whatever, should have something like a child care center in the facility. Because the Kenyan example clearly, if care work has been on the agenda of stakeholders, of leadership, of policy, then they would have made room in the parliament building for child care facilities. So if we make it a policy that every organization, every institution, whether academic or whatever, we should have a child care facility in that institution, at least it will provide leverage for those who have the responsibility to provide care for young babies or whatever, to also contribute their quota by working, and at the same time, at least when they have time, maybe break time or lunch time, the person can go and see how the child is doing and will have the peace of mind to work.
All right. So just before I allow you to go, you've clearly said this ActionAid is championing this campaign, but there's always a big question. So have you engaged stakeholders yet? For instance, have you met with the Minister, Gender and Social Protection, Gender, Women and Social Protection, amongst others? Are you engaging stakeholders? You mentioned that you don't even know if there is a care center or a daycare in the parliament already. Have you initiated steps to find out this? What is your level of engagement with stakeholders?
Okay, we started this conversation last year. We held a national dialogue with the Gender Ministry through their Department of Gender last year, where we started the initial discussion. So yesterday we had another second national dialogue. all in the attempt of bringing stakeholders on board. So at yesterday's event, we had somebody from the Statistical Service, even giving us from the Statistical Service point of view, how they are looking at the unpaid care work. So we are working with stakeholders. We brought others. Yesterday, we also had a presentation looking at how we can even mainstream this issue of care work through the planning processes of the district and the municipal and metropolitan assembly budgeting processes. So we are looking at this from various angles where we are engaging stakeholders, but it's a conversation that we have started and we think we should continue. And this conversation, I don't think it's new in our system, because we are asking that we redistribute care work among the able members of the household. Able members of the household. And this is not a new conversation, if you agree with me. It's a conversation that has been there, and women's rights groups, human rights organizations, and individuals and champions have been talking about this whole thing, that the placing the burden of care on only females is not right, and it is a human rights issue, because it doesn't allow that person who bears that burden even time for leisure. And you know, if somebody doesn't rest, the impact on the person's health. So we've started engaging stakeholders last year on through one of our national dialogues, and yesterday was a second phase or a continuation of the dialogue we started last year, and it's not going to end. We are working with stakeholders, and we believe at the end of the day, it will not be today, but we will come up with something for Ghana, and we hope that all stakeholders will come on board. At the household level, ActionAid we are doing our bit. All other organizations are also doing our bit at the community level,
all
at the household level. But we believe that the state has the power and has the muscle to do more than what NGOs are doing.
Margaret Brew-Ward, thank you very much for joining us. She is a manager, women's rights and campaigns at ActionAid Ghana. We're sincerely grateful for your time. Well, we're shortly moving on to other matters, but before then, we will take a break. When we come back, we still have some updates from our world of business. We would address here with some entertainment issues and also